Hi, I'm Erin Rigetti. I'm here with Partnering 360 Insight at BioEurope Spring in Paris. I'm here with Johan Verbeeck. He's the Senior Director of Partnership Management at J&J Innovation Center in London. Welcome.
Thank you, Erin.
Now, tell me about your background and how you came to be a part of J&J Innovation Center in London.
Well, I've been with Johnson & Johnson for a long time, for 19 years to be precise. My background is actually in R&D. And the last 2 or 3 years before I moved to the Innovation Center, I had morphed into Alliance Management already for R&D. And when the Innovation Center concept was announced, I thought it was the coolest thing ever.
Yeah.
And so when they were looking for a Alliance Manager there, I decided to apply for the job. And guess what? A couple of months later, I was in London. So I relocated my family from New Jersey to London and started working for J&J Innovation in January 2013. So right when the center opened.
Oh, wow.
Center actually opened in March 2013. So we're there from the very beginning.
So how do you connect with the innovation community throughout Europe? How does the center do that?
So as part of J&J Innovation, we really believe in proximity, being close to entrepreneurs, academics, scientists, biotech. So we travel a lot throughout Europe to meet with people on an ongoing basis. We have a 25 people team, and we actually try to spend 60% or more in front of people external to J&J. It's one of the metrics that we have. And obviously partnering conferences such as BioEurope are extremely important to us. Basically everybody we want to meet, or a majority of them, is here. So it doesn't take a lot of hiking. We do the partnering meetings through the partnering system. Works really well. I think now 2.5 years later we've really mastered that system, and we know who we want to meet with, and we do our homework, I would say, up front to try to investigate which are the companies we really want to sit together with. And it works really well. It's very energy intense, I think, this job. You have to be out and about all the time, but it's also a very rewarding job.
It's a people person job.
Exactly.
So tell me more about that. So what are the partnering aims and goals of J&J Innovation London? And are each of the different centers, Shanghai, Boston, London, and California, do they have different goals and different vision, or are they all aligned?
Yeah, so no, the goals for each center are the same. So we work within the strategic areas of Johnson & Johnson. We do not operate in a white space. We are trying to help the company succeed in its strategic goals. So basically what the internal R&D is interested in, that is what the innovation centers are interested in as well, but then from an external perspective. Now the centers are focused on early stage research. That means before proof of concept. So once an asset has shown proof of concept in the clinic, in humans, then we pass it on to business development in Johnson & Johnson, so then they take over. But we are pre-proof of concept, so early stage science. And this can be from target all the way up to phase 1, including phase 1 even. But again, once it's reached POC, then we hand over to BD in J&J. So early stage science within the areas of expertise of Johnson & Johnson, that we think that's very important, that we stick to those areas, that we remain focused to the disease areas that we have, whether it's consumer, medtech or farm, doesn't matter. And we do represent the 3 sectors, so the innovation centers represent farm, consumer, medical device and diagnostics for Johnson & Johnson. Basically each center is a duplicate of each other. They're about 25 people teams. With that difference that in the United States there's also the J-Labs concept, which is our own incubator concept that we have. For the time being we don't have that in Europe. But next to that, every center is a complete duplicate of each other. So we have the experts of each of the therapeutic areas, medtech, consumer, are present in each of the centers.
I'm familiar with J-Labs. I'm actually based in San Diego, and we have one there. So. Finally, what are the particular areas of interest for J&J Innovation in terms of deal structures and vision? You said, of course, it echoes the interest areas of Johnson & Johnson as a whole. Can you just go into that more for people who might be interested in being involved with you?
Well, there is no such thing as a template in our center. We'll set up deals that work for the partner and for us, and it has to be a win-win situation for each and every one of them. I think both the partner and us, we have to feel happy with the outcome of the deal in the end. We try to create value, not only for the partner and for us, but also for the patient. That's very important. I think we're a company that is very patient-centric, and we've been there for a long time. And I think when you create value for the patient, then you create value in that deal, and you create wealth for the companies involved. So patient-centric thinking is very important to us. And all our deals are structured in that respect. We try to keep a line of sight to the clinic and to the patient and make sure that the asset gets where we want it to be.
So in terms of what you said, creating value, can you explain that more or go into how do you create value?
Well, creating value can have many faces, of course. So you have an asset. As we said, we are involved in early stage research. Typically, the value inflection point is when the asset reaches proof of concept in the clinic, and at that time we decide, and that depends indeed on the deal structure. What do we have an option on that asset? Are we going to embark it in J&J? Typically, these days we try to keep these assets with the companies who are developing them, at least up to proof of concept. So we try to help the people in the company, in the biotech company, to develop the asset on our behalf. We incentivize them appropriately, and then at some point we may decide to bring the asset on board in Johnson & Johnson.
Oh, that's wonderful. Well, I know that you've been deeply involved with our events, J&J Innovation in general, and especially coming up in Biopharm America in the fall. You're going to be involved with us, and that's wonderful.
Yeah.
So is there anything else you'd like to tell our partnering interested audience?
Yeah, no, I think EBD Group is an incredible partner for us. I mean, both here, as you say, in Europe and in North America. We have a heavy presence at Bio in the United States, as you know. We're one of the main sponsors there, and also here at Bio Europe we try to be more and more engaged. Tomorrow night we're sponsoring tonight actually we're sponsoring the reception, so we're very excited about that. Yeah, trying to give a bit of a Bio Europe, Bio US feel to the reception tonight.
Yeah, that'll be nice.
We're excited about that. So for us it's wonderful. I mean, if this conference takes away 50% of the work that we otherwise had to travel the whole of Europe for, and now it's just here at our disposal. Yeah. We can talk with anybody we like.
So you're finding a lot of early stage initiatives here that you want to meet with?
Yeah, of course. I mean, they're all here. If you have a biotech company today and you're actively looking to partner, this is the place to be. I mean, where else would you go in Europe? This is it really. If it comes to a European scale meeting at least. There's of course national meetings, but this overarches that, I think. And here you see your friends. It's nice to come to Bio Europe because you know you're going to see people that you've seen at the last Bio Europe. So you keep meeting them, and that repetitive character, seeing people over and over again, is very important to us. Because you don't always end up doing a direct deal with a biotech company, but you want to stay close to them. You want to understand the asset. You want to see it mature, and that's why we like to be here and meet again with those people.
That's great. Thank you for that. And thanks for talking with us.
Thank
today.
you, Erin.
Nice to meet
Thank
you.
you.